Hello people, in this video we want to look at the different types of necrosis, right? So what are the different types of necrosis? Coagulative, liquefaction, then you have caseous necrosis, then we have fat necrosis, and then we have fibrinoid necrosis. So we want to look at the 5 types of necrosis in this video. Earlier on we have already seen the introduction to necrosis, correct? You remember or not? We already have seen the introduction to necrosis. We saw that it is irreversible cell injury, blah blah blah. We saw this diagram which is going to show that the cell is going the cell is going to become swollen and then it is going to rupture. There is inflammatory reaction. All these 3 points are very important. You should write in the exam, right? Cell is going to swell, then it's going to rupture. This inflammatory reaction, right? This much you have to write. Then we saw what happens to the nucleus. There is pycnosis, karyorrhexis, and karyolysis. Any type of necrosis they ask now, all these standard things you will write in each of the necrosis, okay? Remember the spelling of all these: pycnosis, karyorrhexis, karyolysis. All these words you should know. Karyorrhexis, is it? I think it is karyorrhexis. Okay. Then types of necrosis: coagulative, liquefaction, caseous, fat necrosis, fibrinoid necrosis. We have seen a small introduction in the previous video. Then we saw the differences between necrosis and apoptosis. So now we are going to move to coagulative necrosis. So coagulative necrosis, very standard it is, because of sudden cessation of blood flow or because of bacteria or because of chemicals. So this is standard cause of necrosis. Main thing you have to remember is the location. The location are heart, kidney, spleen. Remember heart. If there is myocardial infarction, the person will have coagulative necrosis. Heart, kidney, spleen. The diagram drawn here is actually of the kidney. The hallmark of coagulative necrosis is that, very important here, this is what they will be looking for. The normal cells become tombstones. So what will happen? Tombstone means they will retain their normal cell shape. Okay, the outline is retained. Okay, the cells, the type of the cell can still be recognized, but their cytoplasmic and nuclear details are lost. So you can see here. So the you can still kind of know that they exist. Okay. So here what happens? The cell initially it will swell and they become, it's, eosinophilic cytoplasm. Then the nucleus will have what? Pycnosis, karyorrhexis, and karyolysis. These are standard words that you will write. The only thing new that you learned here is the normal cells become tombstones. The outline of the cells are retained. The cell type can still be recognized, but their cytoplasmic and nuclear details are lost. And these are the only things that are new for you. Okay. Then what happens? The cell digestion fails. So that is why it is always like present like a tombstone. The digestion of the cell and the liquefaction fail to occur. However, eventually the phagocytes come and they are going to leave the debris and fragments of cells. Eventually that is going to happen. So we are done with the, this coagulative necrosis, guys. Actually, gross, was not covered. Gross, initially it is swollen and then it will become shrunken. Okay. So it is early stage they are saying. Pale, firm, slightly swollen, and it is called infarct. Later it is becoming shrunken. That's all we can remember, right? You can't remember much. Early stage, swollen, and it is called an infarct. Okay. Early stage it is swollen, it is called an infarct. So coagulative necrosis done. In the exam, try to draw this diagram of kidney, glomerulus, tubules, and then you can draw some tombstone kind of cells where the outline of the cells are retained. So you can tell what type of cell it is. Okay. Moving on. Now let us go to liquefaction or colliquative necrosis. Liquefaction or colliquative necrosis. Here what happens? Again, same thing. Due to ischemic injury, bacterial, fungal infections. But here the hydrolytic enzymes have a predominant role and they produce a semi-fluid material. So that is why this name liquefaction necrosis. Okay, it happens in the brain and abscess cavity. You should remember the examples: brain and abscess cavity. Gross, how it will be? Here it will be liquefied, soft liquefied, and there will be a cystic wall which will form later on. Okay, so what is there in this liquefaction necrosis? There are necrotic debris which has the macrophages which have phagocytosed the material, the cells. Microscopy, you have cystic space which is surrounded by cystic wall. Cystic space has the necrotic debris and the macrophages with the phagocytosed material. So the macrophages have phagocytosed those material, right? That and the necrotic debris will be in the cystic space. Around it there is a cystic wall. So where is cyst wall? Cystic wall. Cyst wall is in liquefaction necrosis. Remember how many people are sleeping? We are looking at liquefaction necrosis. Example, brain, abscess, cavity, etc. Here what happens? There is cystic space and around it there is a cyst wall. Okay. Now this cyst wall, whatever cyst wall will happen, cyst wall will have capillaries, inflammatory cells, etc. And also they'll have proliferating glial cells or proliferating fibroblasts based on the location. If it is the brain, there will be in the cyst wall proliferating glial cells, that is called as gliosis. These are typical terms that you have to write in the examination. Gliosis, okay, in the cyst wall. Cystic space, okay. Cystic wall surrounds what? The cystic space. So, what diagram you will draw? You can draw kind of nerves, glial cells, gliosis, that is, and here you have the liquefactive necrosis of brain. If you need more clear diagrams, you can go to the textbook and look at them. Okay. We cannot use the textbook material, I guess, because of copyrights. Hence, to take no chance, we have started using our own diagrams. Okay, let's move on. So, we're done with liquefaction necrosis. Next move on to caseous necrosis. Caseous necrosis is not difficult. We've already seen it so many times, right? In type 4 hypersensitivity, in tuberculosis, right? Now, let us move on to caseous necrosis. See, caseous means cheese-like. And here what happens, the necrosis is found in the center of the foci of the granuloma. So in tuberculous infections, the center of foci, you will find caseous necrosis, the cheese-like necrosis. It combines both the features of coagulative and liquefactive necrosis. Now what will you see in gross? In gross, you will see dry cheese, it will resemble dry cheese-like material. It is soft, granular, yellowish. Okay. The appearance is because of histotoxic effect of lipopolysaccharides. Why this cheese-like appearance? Because of histotoxic effects of lipopolysaccharides. Right? Because of histotoxic effects of lipopolysaccharides, which are present in the capsule of the tubercle bacilli. Liposaccharides present in the capsule of the tubercle bacilli. Now, how many people are sleeping? What is the bacilli which causes tuberculosis? Mycobacterium tuberculosis. So, write that here. Which is the bacilli? Mycobacterium tuberculosis. So guys, we are looking at caseous necrosis. We have finished the gross. Gross is dry cheese, soft, appearance, granular, yellowish. Almost everything we have seen yellowish only it says. So dry cheese, you should not forget this word. Yellowish, you should not forget this word. And why it happens? Because of lipopolysaccharides which are present in the capsule of the tubercle bacilli, Mycobacterium tuberculosis. Now here's the diagram. It has capsule, cell wall, etc. And these all are actually pili. Okay. So cell membrane, cell wall, capsule. The capsule has lipopolysaccharide which is going to have the histotoxic effects which are going to form this necrosis, which is caseous necrosis, which is looking like dry cheese. Microscopy, not at all difficult. You will draw this diagram, right? So, the center of the necrosed focus contains structureless eosinophilic material. You can see eosinophilic material having scattered granular debris of disintegrated nuclei. So, you have to draw here some granular debris of disintegrated nuclei. Then you have granular matrix inflammation around this caseous necrosis. It contains the epithelioid cells, which are nothing but the modified macrophages, which are slipper-shaped vesicular nuclei. Oh, the nuclei is slipper-shaped. Oh, the nuclei is slipper-shaped. Okay. Then you have interspersed giant cells of Langhans and foreign body type and peripheral mantle of lymphocytes, which are drawn here. Okay, let's just write all this, whatever we have understood so far in the microscopy of caseous necrosis. So you have eosinophilic, in the center you have necrosis with what? Scattered granular debris of disintegrated nuclei. Okay. Then around it we have the granuloma, in which what and all you have the epithelioid cells, which are nothing but the modified macrophages, which are slipper shaped, having vesicular nuclei. Not sure what exactly is slipper shaped, they didn't write the textbook properly. Then you have giant cell of Langhans, giant Langhan cell. Okay. Then you have lymphocytes. Now we are moving on. We are done with caseous necrosis, cheese-like necrosis. Okay. So draw this diagram. This is the lymph node in tuberculosis. Okay. Now moving on to fat necrosis, guys. This is a special form of cell death occurring at fat-rich anatomic locations. So you can see in breast, pancreas, etc. Fat-rich locations. Is the pancreas rich in fat? Mesenteric fat necrosis due to acute pancreatitis. This is not in pancreas, but it is seen in mesenteric fat due to acute pancreatitis. It is not actually in pancreas, it is mesenteric fat. It is seen in mesenteric fat due to acute pancreatitis. Okay, let's just correct it in our previous slide also. Here, just write here, mesenteric fat due to acute pancreatitis. Due to is better. Right? Here you write liquefaction, you write brain and abscess cavity. Clear, right? Anybody has problem in this understanding? Okay. So now we are going here. We are in fat necrosis at the moment. So it will be in anatomically fat-rich locations like breast and mesenteric fat due to acute pancreatitis. It is a special form of cell death. Now in this case, what happens, especially in acute pancreatitis, there is liberation of pancreatic lipases from injured or inflamed tissue. So there is necrosis of the pancreas as well as the fat depots throughout the peritoneal cavity, sometimes affecting the extra abdominal adipose tissue. So there can be, So in what happens in acute pancreatitis, there is liberation of pancreatic lipases. So there can be necrosis of pancreas and in the peritoneal cavity, whatever fat deposits like the mesenteric fat is affected, and even extra abdominal adipose tissue can be affected. So this is in acute pancreatitis. So this is more like pathogenesis. Okay. So why it happens? Because of injury or inflammation. So all the causes you can write. Then what happens in this? There is hydrolysis and rupture of adipocytes. So what actually happens to the fat tissue? There is hydrolysis and rupture. Hydrolysis and rupture of adipocytes. Okay. And there is release of neutral fat which changes into glycerol and free fatty acids. So what and all happens? There is release of neutral fat which changes into glycerol and free fatty acids. So what is coming out of these adipocytes? Free fatty acids. Okay. Neutral fat. Now the free fatty acids which are leaked out, they form a complex with calcium and form calcium soaps. This is what is very important for you. Calcium soaps. This word they'll be looking for in fat necrosis. What happens? The free fatty acids plus calcium will form calcium soaps. This is called as saponification. Okay. So this is dystrophic calcification. Dystrophic calcification. Why it is dystrophic calcification? Because here the calcium metabolism is fine, correct? Calcium metabolism is fine. Only at specific local areas there is calcification. That is because of problem in that area. Like in this case, there is fat necrosis. So how many people are understanding fat necrosis and how many people are sleeping? What about you guys? So, okay, now we are discussing fat necrosis. So let us look at the gross and the microscopy. Fast. Let's look at the gross. Now, gross of fat necrosis, guys. Here it appears yellowish white. Just say yellowish white and you will get a lot of marks. Yellowish white everywhere. All necrosis, write of yellowish white. Firm deposits. Just remember that cheese soft, liquefactive also soft. Others are firm. Okay. Cheese and liquefactive, caseous and liquefactive are soft. Obviously, right? Liquefactive will be soft. Cheese-like also will be soft. Now, fat necrosis, firm. What else you will remember here? Calcium soaps. Okay, you can see calcium soaps. It will look chalky white. Chalky white. Okay. Again, firm. Because there's calcium, there will be chalky white, firm. Now, let's move on to the microscopy. Microscopy, you can look at this diagram here. So, they have cloudy appearance. The necrosed fat cells have cloudy appearance. They are surrounded by inflammatory cells. Okay, they are surrounded by inflammatory reaction. Calcium soap can be identified, okay, as amorphous granular basophilic material. Maybe we should draw some amorphous granular basophilic material. Hold on. So, we have added here amorphous granular basophilic material, guys. So, here you have cloudy appearance. Then you have calcium soap. Then you have inflammatory cells. Calcium soap, how it will look? Amorphous granular basophilic. Cloudy, what is cloudy? The necrosed adipocytes, correct? Hold on. So, you have the necrosed fat cells are cloudy. Necrosed fat cells are cloudy. Inflammatory cells are present. That's all, guys. Fat necrosis is done. Fat necrosis not so difficult, correct? Where and all you will see fat necrosis, breast, mesenteric fat in acute pancreatitis. Here you will see what are the salient features. You have to write about calcium soaps. You will draw the diagram, show inflammatory cells, cloudy appearance and calcium soaps. Very good. Now let us move on to the last type of necrosis. You have the fibrinoid necrosis. Fibrinoid necrosis, guys, it occurs due to immunologic tissue injury. So it is here we have shown in this diagram autoimmune vasculitis. So around the blood vessel there is fibrinoid necrosis, correct? The blood vessel shows fibrinoid necrosis. It is just let us look at this in detail. Take a deep breath, guys. We are in the last type of necrosis. Take a deep breath. Okay, fibrinoid necrosis. Now, fibrinoid necrosis, here there is deposition of fibrin-like material. So, it has properties of fibrin. So, it will have properties of fibrin. We'll come to all that. Hold on. So, basically, we saw deposition of fibrin-like material. So, it will have properties of fibrin. Obviously, it will have properties of fibrin. Like, what are the properties they are saying? Phosphotungstenic acid hematoxylin stain. So, it takes up phosphotungstic acid hematoxylin stain. That is PTAH. Phosphotungstic acid. Phosphotungstic acid hematoxylin stain. Okay. So, in this is mainly due to immunologic tissue injury. We have already told this. Example is immune complex vasculitis, autoimmune diseases or Arthus reaction, etc. So, we have seen where in autoimmune vasculitis, then Arthus reaction. What is Arthus reaction, guys? You remember type hypersensitivity, you remember? It's a local type 3 hypersensitivity reaction, remember, because of immune complex, right? That is what is type 3 hypersensitivity. Then you have in arterioles, in hypertension, in peptic ulcer, etc. Should we remember all this? Arterioles. It should not be difficult to remember arterioles because you are studying vasculitis, arterioles, peptic ulcer. Peptic ulcer, there is fibrinoid necrosis. Oh, wow. So let's now directly go to microscopy. Here the vessel wall, there will be hyaline-like deposit. Remember this word, it's not hyaline deposit, it's hyaline-like deposit, right? And this is going to be bright eosinophilic. Now the necrotic focus is surrounded by nuclear debris of neutrophils. So you can see here nuclear debris of neutrophils. There's going to be nuclear debris of neutrophils. Fine. This is called as leukocytoclasis. Leukocytoclasis. Local hemorrhage may occur due to rupture of blood vessels. Obviously, it is affecting the blood vessels, so local hemorrhage can occur due to rupture of blood vessels. So we are done with fibrinoid necrosis. Let's look at the important words here. Fibrin-like material, everything is like only. Hyaline-like deposit. It will take up the PTAH stain because it is fibrin. That is phosphotungstic acid, hematoxylin, hematoxylin you should say, or hematoxylin you should say. Hematoxylin stain. So autoimmune vasculitis word you should remember. Leukocytoclasis is there. Microscopy of vessel wall, hyaline-like deposit, bright eosinophilic, nuclear debris of neutrophils, leukocytoclasis, this is called. Local hemorrhage can occur due to rupture of blood vessel. Draw this diagram if you can. I think fibrinoid necrosis is not that important. What do you see? The most important necrosis for the exam are caseous necrosis and fat necrosis, guys. So just let's look at these again. Caseous necrosis, dry cheese, lipopolysaccharides present in the capsule of tubercle bacilli. Then you will draw this diagram with the granuloma, right? Fat necrosis, you will draw the cloudy appearance. Calcium soap. Okay, most important. So let's wind up this video, guys. Take a recap. Hope you are able to see. Liquefaction. Caseous. Caseous is a combination of coagulative and liquefaction, and TB. TB, that is a combination of both. Last one is fibrinoid necrosis. Okay, so we are done with all the necrosis. See you guys. See you in the next video. Bye bye.